morning, everyone. It's great to be here today with Dr. Kerry Chan, our Chief Health Officer, as well as the Deputy Premier, Paul Toole, the Treasurer, Matt Kean, the Small Business Minister, Eleni Petinos, Dan Hunter from Business New South Wales, Alexi Boyd from Cosboa, and Wes Lambert from the Restaurant and Catering Association. Can I begin, obviously, by acknowledging that the fact that over the last 24 hours we've had 52 people die with COVID. On behalf of the New South Wales Government, on behalf of everybody across our state, can I extend our condolences to the families, our thoughts and prayers and our hearts are with you today and over this difficult time for you. One point before I talk about the financial package we're announcing today that I'd like to make. There's a sustained push here in our state for boosters. We have today around 40% of the eligible population in New South Wales who have received a booster shot. There are many appointments available right across our state. We know that just a week ago we had capacity for an additional 100,000 bookings in our hubs alone. So whether it's in the 40 hubs across the public health team here in New South Wales, or pharmacies, or GPs, can I please urge everybody who has not gone out and received that booster shot to do so? We know that that's key. We know the evidence is very clear, whether that's in New South Wales, anywhere around the country or anywhere around the world. Vaccinations and boosters work. We have in Australia and New South Wales particularly one of the lowest death rates anywhere in the world. One of the lowest hospitalisation and ICU presentation rates anywhere in the world. And why has that occurred over the last 2 years? It's occurred because people have gone out and been vaccinated. It's very, very clear. That's what set New South Wales and Australia apart from anywhere else in the world. And I know it's been a difficult 2 years. I know people are tired. I know many people have made enormous efforts, enormous sacrifices over this period. But we need to continue to push through. We need to continue to sustain the efforts that everyone has made. And boosters are key to doing it. So please, my message today for anyone across New South Wales, if you have not made that appointment, please do so. It is key to keeping you, your friends and your family safe. The effort of the past, if we continue that over the next 12 months, that will ensure that we continue to come through strongly out the other side. When you take a step back from everything over the last 2 years, our health response has been strong, our economic response has been strong, and that's because of the efforts that everyone has made across the state. So please, one last push, if people can continue to go and get that booster shot, make an appointment, make it the resolution today, make that appointment today and ensure that you keep safe during this period of time. So obviously today we're announcing our financial support package for businesses. We know that many businesses, particularly over summer, have done it tough. Many businesses with a furloughed workforce have had to close for a number of days, but we are seeing confidence come back, and that's incredibly pleasing. But we've always said as a government, and what has been our guiding principle over 2 years during this long pandemic, has been that we will always put our businesses and our workers before the budget. And we've been able to do that in our state because of our strong financial management over 10 years. Our economy here in New South Wales, leading into this pandemic, strongest in the nation. Our budget, the strongest in the nation. And by being able to do that, we've been able to deploy our financial might to help businesses get through the difficult times of lockdown, and now we are doing that again. So today's announcement for small businesses of a turnover of less than $50 million, and if you've had a 40% downturn over this summer period, we will provide 20% of your wages bill to a maximum of $5,000. We know that this will help many small businesses who have been doing it tough. The Treasurer and I had a chat with a number of businesses just here this morning, and we know it's been a difficult time, but we have businesses back. We've had the back of businesses through this entire pandemic, and that is not going to change. The other announcement, a couple of other announcements today in relation to the package, which the Treasurer will go through in further detail. We have a fees and charges grant and rebate, which is currently at $2,000. We're increasing that to $3,000, and we're providing the opportunity for businesses to also incorporate the purchasing of rats as part of those grants. So that will be available as well. The other point is extending supports for landlords who are providing rental relief for tenants. And this has been a successful program over the last 2 years. But what I'm certainly noticing when I'm speaking to businesses across the state is that some of that communication has fallen away between landlords and tenants. So I really want to encourage landlords today and tenants today to get in contact with each other. We've provided the opportunity for rental relief during this period of time, but there's also support there for landlords through land tax relief and the like. So the best thing that we can do, and I think what's really helped our state over this period of time, is we've worked together. We've worked together, we've looked out for each other. So if we can continue that over the course of 2022, that will ensure our businesses get through. So if you're a landlord, please work with your tenant. If you're a tenant, please work with your landlord. By coming together, looking out for each other, we'll all get through this. So these are the changes we've made today. It's based on the principles of the past. Our approach of the past continues through 2022, and that is to support and have the back of every business in this state, of every worker in this state. When we get through this pandemic, what's going to be key and what success looks like is based on the fact that we've been able to keep our health system in a very strong position, that we've been able to provide the care, love and support for those who need it. Ultimately, we've kept businesses going and kept people in work. That is what we focused on over the last 2 years. That doesn't stop today. That's why I'm very proud of the work the Treasurer has done. I want to thank the stakeholders who are here today, and the engagement in terms of industry, in the development of this package. I know people have said, a lot of interest in terms of when this package will come. I'll make this point. No other jurisdiction in the country, no other jurisdiction, no other state has to date has provided financial support except New South Wales, because that's the New South Wales way. We are always here to look after businesses in this state. And as I've said over the last week or two, from my experience as being Treasurer over the last 2 years, what is most important when you're putting together a financial package is that the dollars you spend, the taxpayer dollars you spend, are invested for impact. And the best way of determining that is not just speaking to Treasury, it's speaking to every business group across the state, getting that feedback and applying it. That's exactly what the New South Wales Treasurer has done. I want to thank him for his work, because targeted support gets businesses going, gets businesses moving through, and ultimately ensures that people stay in work. So I want to thank the work that he's done. I want to thank the stakeholders for the engagement, the constructive way they've worked with the New South Wales Government during this period of time. And finally, can I just continue to say to people across the state, we're in a strong position here in New South Wales. Let's all continue that effort getting boosted. Let's continue to treat everybody with kindness and respect, as we've done over the last 2 years, and that will ensure that New South Wales continues to move strongly through this pandemic. I'm now going to pass to Dr. Chan, who will provide a public health update. The Treasurer will then go through the finer details of the financial package that we are releasing today. The Deputy Premier will talk particularly to the impact that this support package will have on the ground in regional New South Wales. The Small Business Minister, Eleni Petinos, will then provide some information in relation to the support for small business today. And then our three members, Alexi, Dan Hunter and Wes Lambert, will speak to the importance of this package in support of their industries.
Thank you, Premier. So getting vaccinated will be part of living with COVID, as it is with other infectious diseases such as flu. And I just want to stress to the community that being up to date with your immunisations for COVID involves having that booster dose. So people should consider those 3 doses essential to being up to date with your vaccination. And for some, those with underlying conditions which suppress their immune system need actually to have 4 to be considered up to date. So please check what is right for you and get vaccinated. It's pleasing to see that we have 94% of people aged 16 plus having 2 doses of the COVID vaccine, but it's never too late. There are still people that are unvaccinated, and can I just stress that it is important that you start your journey, your vaccination journey, as soon as possible. Those 3 doses of vaccine afford the greatest protection. We're seeing a little bit of an uptick in the 12 to 15-year-old age group. It's got to 83.2% have had their first dose, but we really need to get that higher. We've achieved 95% double vaccination coverage roughly in a number of age groups, and I'd like to see that group lead the way as well. We've got 37.4% of children have had their first dose, and 40.8% of the eligible population have received the boosters, and I thank those people for coming forward. We currently have 2,663 people in hospital, including 182 people in ICU, of whom 73 are ventilated. We've had 13,524 positive test case results returned, and that includes 6,032 positive rapid antigen tests and 7,492 PCR tests. Now that 7,492 positive PCR tests were returned from 50,771 PCR tests. Sadly today we are reporting the deaths of 52 people with COVID, 33 men and 19 women, and can I echo the Premier's condolences to the families for their losses. Of the 52 people who died, 3 people were in their 60s, 11 people were in their 70s, 26 people were in their 80s, 11 were in their 90s, 1 was aged more than 100 years old. 31 of the 52 deaths were aged care residents, 21 died in aged care facilities, 31 died in hospital, and no one died at home. And of those 31 people, just 2 had received booster doses. 20 had received 2 doses of the vaccine, and 2 had received 1 dose, and 7 were not vaccinated. Again, reinforcing the importance of boosters. And 1 person who died aged under 65 was a gentleman in his 60s. He had received 2 doses of the vaccine and had significant underlying health conditions. I just also want to alert the community and the media to the fact that we will be changing and adjusting our cut-off periods on the first Tuesday, the 1st of February. So this means that the reporting period information will go from 8 p.m. close-off to a 4 p.m. close-off. Now the reason for that is we are transitioning our public reporting to allow our epidemiologists and surveillance officers and data analysts that have been working day and night to move into a more sustainable footing. This will also allow them to focus on some additional work in epidemiological reports and provide more granular detail that will support the community as we move forward with our COVID response. So I just wanted to acknowledge the efforts of all of those in New South Wales Health and the local health districts who have been working tirelessly to collect those feeds. So that small adjustment in the time will really allow us to focus our resources to doing that more value-added epidemiological work. I would also just like to know that there's been discussion about the BA2 variant, and just wanted to confirm that we have detected some of the BA2 variant, but there's likely to be more. So we've had 4 sequences identified as BA2. Just for clarity, this is a sort of sub-lineage, a sort of breakaway, a subvariant from the Omicron variant. We know that it is circulating in countries, and we've seen it grow significantly. So for instance, in Denmark, it's now the dominant over BA1, and we're seeing its prevalence, the proportion of BA1 grow in some other countries. So we think it might have some growth advantage over the BA1, the Omicron, the original Omicron. But at the moment we don't see that it's presenting anything different clinically in terms of the severity or its response to vaccines. But we'll obviously be watchful, monitor the situation closely. Also, we've been using, just to explain, we've been using the pathology tests that look for S gene dropout, but this variant actually retains its S gene, so that's why we need to wait for those special genomic sequencing to get a better handle on its distribution. So again, I would just also finally just like to go through the isolation procedures, just to reinforce this with individuals. Can I thank everyone for their work in isolating after they've got a diagnosis of COVID. It is the one essential thing we can do. It is one of the most effective. When you've got COVID, you are infectious. You're most infectious just before you've got symptoms. and for a period after, but that period may extend up to 7 days and beyond. But largely, your infectiousness declines rapidly after that bit before and after symptoms. So we are asking people to isolate for 7 days. If you don't have any symptoms at the end of the 7 days, then you're free to leave isolation. But we do ask that you just take special precautions in relation to not visiting aged care facilities or very high-risk settings for the next 3 days if you're able to. Or if you work in those facilities, please discuss with your manager of those facilities what extra precautions or what the organisation would prefer to do. So please remember it's 7 days with an additional 3 days if your symptoms have resolved. If you still have persistent symptoms, and the reason this is so difficult is that people sometimes have some persistent symptoms which are not related to being infectious, we ask you to just read our fact sheet, which is called Testing Positive for COVID, and talk to your doctor if you need further clarification about whether you're able to leave that isolation on day 7. Thank you.
Thank you, Dr. Chance. I'd like to begin by acknowledging that this has been a particularly difficult summer for so many families across New South Wales, particularly those that have lost loved ones, and I want to express my condolences to all those families that have lost a loved one during this Omicron wave. I'd also particularly like to acknowledge the especially difficult time that businesses across New South Wales have faced, particularly our small business sector. Those businesses that ply their trade through face-to-face trading, your hairdressers, your beauticians, your hospitality sector, they have done it so tough. We acknowledge that, and that's why today I'm announcing the most comprehensive business support package in the nation. This is a $1 billion support package to help our small business sector get through to the other side so that they can bounce back better and support our economy. The package includes money that will be spent to support businesses. We will pay businesses that have a turnover of less than $50 million 20% of their payroll. So that's up to $5,000 each week for the month of February. They have to demonstrate that they've experienced a decline of 40% turnover for the month of January and expect that decline to continue for February. This is about supporting our small businesses to keep the doors open, because we know household balance sheets are strong at the moment. When we get out of this wave, we expect a snapback and that the economy will bounce back better on the other side of this. So this is about facilitating small businesses to get through to the other side so that we can bounce back better. In addition to that, we're also supporting small businesses not only continue to trade, but also to protect their workers and their customers. We're expanding the small businesses fees and rebates package by $1,000, taking it up to $3,000. That money can now be spent on rapid antigen tests. We'll cover 50% of the cost of rapid antigen tests. That money will come online by March to ensure that we don't put additional pressure on the supply of rapid antigen tests in the market. It will come online at a time when there will be enough rapid antigen tests to ensure that they're accessible and affordable for everyone in the community. In addition to that, we know that the commercial landlord sector is doing it tough because of the rent relief that they're providing small businesses. So we're supporting our commercial landlords by extending the commercial landlord grant up to $3,000 for those commercial landlords that have provided rent relief to small and medium businesses across New South Wales. Finally, we know one sector of the economy has been hit particularly hard, and that is the performing arts sector. So we're announcing a package of around $80 million to underwrite ticket sales for those theatre performances, plays and performing arts events that have been impacted by a drop in demand over this summer period, and for those that could anticipate a drop in demand in the future. We'll underwrite their ticket sales so that they can continue with rehearsals, continue planning the event so that they can get their performances on stage for the time when this wave will pass. Small business is the engine room of the New South Wales economy. It's one of the biggest employers in the state. So it's critical that we prop them up at this time, because we know if we can keep their doors open, we can ensure that our state's economy bounces back better on the other side. We estimate that the cost to the New South Wales economy of the Omicron outbreak has been about 60% of that of the Delta outbreak. So it is having a huge impact on the economy, not as large as Delta, but it's particularly being felt by some sections of the economy. That's the small business sector, retail, tourism, hospitality, and faced those businesses that ply their trade through face-to-face trading like hairdressers, beauticians, etc. Just like the New South Wales government stood by New South Wales businesses with the Alpha outbreak, just like the New South Wales government stood by businesses with the Delta outbreak, so too will we stand shoulder to shoulder with businesses during the Omicron outbreak to help them get through this wave and come out stronger on the other side. I'll take some questions, but now I'll hand over to Deputy Premier Toole.
Well, thanks, Treasurer. Look, businesses have been doing it tough, but businesses have also been doing it tough not only in the metropolitan areas but also in regional parts of New South Wales. But we want to make sure with this package it actually is supporting businesses, allows those businesses to keep their doors open but also keeping their workers safe. And we want to see regional communities humming once again. We want to see visitors going back into those communities. We know how important these businesses are. They are mums and dads' businesses. We've seen the tourism sector being impacted, and this support package is going to be very welcome news. I've travelled to Muswellbrook in the last week, Port Stephens, Raymond Terrace, Newcastle and Queanbeyan. I've spoken to many business owners, and I can tell you today that this announcement is going to be very welcome news. The message is very simple. We know businesses have been hurting, and we've got their back.
Good morning, everyone. We know that small business is the engine room of the New South Wales economy. There are 800,000 small businesses in New South Wales employing more than 1.6 million people. We know that the over 800,000 businesses in New South Wales, we know that the over 800,000 small businesses in New South Wales have been doing it tough, particularly due to the Omicron wave of the pandemic. And this package is about ensuring that we can keep their doors open and people in jobs. We know how essential these small businesses are to small regional communities and to all communities throughout this state, which is why this government has been standing shoulder to shoulder with small business to ensure that businesses remain open, people remain in jobs, and that through this package, cash flow is available, people remain safe and happy to go to work, and that these doors are open for everyone to enjoy the facilities in their local communities. Further information is going to be available shortly on the Service New South Wales website about how to apply, and we know that this is the most generous package in Australia and that the New South Wales Government will remain standing shoulder to shoulder with small business as we have done through the entire pandemic and will continue to through the Omicron wave of the pandemic.
Good morning, everybody. Small business really welcomes this package. It's much needed, and I'd like to acknowledge the excellent work that the New South Wales Government has done with collaborating with small business on this as well. What it does is acknowledges that small businesses have been bending over backwards to be able to keep their communities together, keep their workers safe, and keep their businesses open. And it's been very, very difficult because of worker shortages, because of supply chain issues, and because of the virus, of course. And nobody wants to walk down the street and see small businesses shut, because they are not only the engine room, but they're the soul and the life of communities everywhere across New South Wales. So we're really pleased to see that this New South Wales Government is acknowledging the importance of small businesses in community, but not only the ones that we can see being closed, but also all of the background businesses that support those through supply chain, through deliveries, through business-to-business work, accountants, bookkeepers. Everybody is really important to small businesses right now, and this sort of support really recognises the importance of all small businesses in the community, and I'd like to thank the New South Wales Government for their support. Thank you.
Morning, everybody. My name's Dan Hunch. I'm the CEO of Business New South Wales. The support package today will be welcomed by business. I would like to thank the Premier and the Treasurer for all the hard work on this, and all the hard-working people in the New South Wales Government. When we went to businesses and surveyed them in the lockdown last year, 50% of those businesses told us that if they hadn't had that support from the government, that they wouldn't have been able to reopen. What this support package does is it keeps businesses open. It will keep some businesses afloat, people's life work, people's businesses, and they won't close. They'll stay open and they'll be able to remain in business over that longer term. And that is what is important here, is around people and people's lives. The other message I'd like to give today is that New South Wales does have one of the best health systems in the country. Congratulations to New South Wales Health. It's now about getting out and about in a safe way and enjoying ourselves. We need some consumer confidence to return, some business support to return, so we'd encourage people to think about those low-risk activities that they can do, things they can go out and do, shopping and retail safely, going out to a local cafe, sitting outdoors, eating at restaurants, taking a trip. Get out and support your businesses and do it in a safe way. Thanks very much.
Good morning, Wes Lambert, CEO, Restaurant and Catering Australia. I certainly want to thank the Premier, the Treasurer, the Deputy Premier and the Small Business Minister for this business support package, and certainly for the collaboration that the Premier's office and the Treasurer's office had with Restaurant and Catering for this package. We certainly appreciate that business support has been given to small businesses, including the hospitality industry, which we all know is one of the hardest hit industries during the pandemic. We certainly reiterate some of the things that are said before. We need to get out there and support small businesses like restaurants, cafes and caterers as one of the biggest industries in Australia and one of the largest employers in New South Wales is the hospitality industry. So it is very important that we continue to advocate for additional funding from the federal government. We would have liked them to have supported the New South Wales government in this business support package, and Restaurant and Catering will continue to do so. But we certainly thank the Premier and the Treasurer's office for releasing this package today. Thank you.
Thanks, Wes. Okay. Sorry, that took a while. Let's go. Treasurer?
You had a fairly fiery crack at the feds this morning on Sunday night, I think. Just how angry are you that they aren't involved in this? Is this why you haven't updated into January?
Well, I'm very disappointed. I was hoping to make this announcement standing beside the Prime Minister today and the Treasurer at Frydenberg, but they're not to be found. Just like these are not just New South Wales businesses, they're Australian businesses that pay their taxes to the Commonwealth government, Australian businesses that are doing it so tough at this time. So what we want to see is, rather than the Commonwealth government stepping aside, we want to see the Commonwealth government stepping in, like the New South Wales government is doing, to support small business, and in doing so, supporting our national economy, because that's in everyone's interest to do so. So I am disappointed, and I hope the Commonwealth government steps up to help New South Wales small businesses and small businesses across the country, because it's in our national economic interest to do so.
20% of payroll, you're paying companies 20% of their payroll tax if they have free expression, right? But 20% is only half of what they were getting last year. Surely some businesses, 20% won't be enough.
Well, we've worked very closely with business groups, industry groups and businesses on the front line. We've developed a package that is targeted to go to those businesses that need it most, to support those businesses that will be viable over the medium term. We want to get them through this wave so that they can help our economy bounce back better on the other side. And what I'd like to see is the Commonwealth, instead of stepping aside, stepping in to support those small businesses so that we can pay 40% of payroll and help those businesses stay afloat even longer to turbocharge our state's economy and our nation's economy going forward. I mean, the New South Wales government stepped up when it came to the bushfires. The New South Wales government stepped up when it came to supporting farmers through the drought. The New South Wales government stepped up when it came to tackling climate change. And the New South Wales government is stepping up to support small businesses through the Omicron wave. And rather than the Commonwealth government stepping aside, we expect them to step up as well.
It's going to be available to apply, businesses can apply from mid-February. When do you expect them to actually see cash?
One of the things we've done is take the time to be able to stand up this package to ensure that we can get cash in the pockets of businesses as soon as possible. So we've worked with Service New South Wales to bring forward how quickly applications can open and how quickly we can get cash out the door. So applications will open mid-February. We expect, because of the good work of Service New South Wales, that after you lodge an application, the majority of businesses will get cash in hand 5 to 15 days after they make that application.
That seems very quick. It normally takes 3 weeks. How is it going to be so quick?
We took the time, we took a little bit longer to plan this, but what that's meant is that we'll speed up how quickly we'll get applications open and how quickly we'll get cash in the pockets of those businesses that need it. This is about ensuring that we support our businesses to ride this wave so that we can help our economy bounce back better on the other side. We've worked closely with business, we've worked closely with industry, and we've got a targeted package that's going where it's needed most. We're not going to splash cash wildly across the economy. It's targeted and temporary to ensure that those businesses who need it most are able to get through this wave and help our economy bounce back stronger on the other side.
Can you give a commitment to businesses that they will get cash between 5 to 15 days of applying through the Service New South Wales platform? Because last year with the basket case, businesses were maybe waiting weeks and months and it didn't work.
We think that the majority of businesses will be able to get cash in hand 5 to 15 working days after they make their application. However, there will be areas, some businesses that maybe don't fill out their application forms properly, need to have some of the claims they make verified, which could take a little longer. We've obviously got some checks and balances in place to make sure that we avoid as much fraud as possible and that we safeguard taxpayers' money. But my aim is to stand this up as quickly as possible and get cash in the hands of those that need it as soon as we can.
Dominic, could I just ask you a question, please? 31 deaths today are in aged care. Are we using the battle in aged care?
Look, I just want to acknowledge that aged care is a very challenging, setting. Clearly, we need, there's a lot of staff working in aged care. There's visitors to aged care. It is very difficult to keep COVID out of aged care, despite the amazing amount of work that's being done to do so. I think the single most important factor is to get that booster doses into our aged care residents and for the elderly, for other elderly residents anywhere, and people with underlying health conditions.
So how disappointing then is it that those boosters have not been made available in aged care, that more should have been done?
Well, I understand the Commonwealth is rolling out the program and is progressing that. Obviously, we're very keen to work with the Commonwealth in terms of the response. But clearly, I would want to see people in aged care facilities boosted as soon as possible. General practitioners are able to boost people, organise vaccinations as well. So I just would urge anyone who has a loved one in aged care facilities to check when the booster program will be coming there to support your parent or your son, your mother or father who's in that aged care facility to get consented for the vaccine if they are not able to consent themselves. So I really would want everyone who has got any relatives or people that they are guardians for in aged care to really support them getting the booster dose. I think it's really important. We can't stress enough this message that the boosters are being up to date with your vaccinations. And I think that some people are thinking, oh, two's enough. Two's not enough. You need the third, and for some people it will be 4.
In the way that
do we need to think about taking the aged care guys out of aged care and putting them in the hospitals? Because, are the facilities up to scratch? Do they have the ECMO treatments, the ventilators that you need? You seem to be seeing a large number of deaths.
I think that there's probably 2 factors that we need to recognise. That many people in aged care facilities have got many chronic underlying health conditions. Some of them will have had what's called advanced care directives, where they will have discussed with their family, their doctors, about what sort of life-saving interventions that they would want. And in general, a proportion will say they don't want aggressive treatment and management. We've got to also remember that aged care facilities, residents, it is the home of the person in the aged care facility. And so they do have to have control about what sort of care they want, whether they want to be moved to a hospital and whether their clinical circumstance. But many will choose to be in a place that they feel safe, surrounded by things that are important to them. I've said this before, that because of the age profile and the fact that the health conditions of many people in aged care facilities, even just a small stress on their system can potentially lead or hasten death. Now, many will have other concurrent illnesses, and many may well be on towards an end of life or palliative pathway. But the single most important message I draw from looking at this data is the need to boost, because once we've boosted our aged care residents, that will give them the best chance of not being impacted by COVID. And also we will be also having ability to access antivirals. So the Commonwealth Government has also, as you're aware, the TGA has provisionally registered a number of antivirals, and those products will be coming in February, and we'll be able to use those as an additional tool in aged care, and the Commonwealth is leading that work, and clearly we are here to work with the Commonwealth on how we can also use that new tool, which is the antivirals.
How many of the, Dr. Chung, are you expecting daily deaths to plateau around this level, and if so, for how long? As long as a year?
The deaths reflect the transmission in the community. So we will be expecting, but they also have a significant lag period. So we're sort of seeing deaths sort of lag that 2 to 3 weeks after the cases. So the best thing we can all do is get our boosters, because that will also drive down transmission. As we're out and about, take those simple COVID-safe measures, not be out and about when you've got symptoms, instead get tested. That will all lead to a lower level of community transmission, and hopefully we'll therefore see less people positive going into aged care facilities.
What are your scenarios show for plateauing of daily deaths in the upcoming period?
I would expect the deaths to still remain high for the coming weeks, and as I said, to some extent it is in people's hands how we manage the case numbers. So we are, the single most important thing, and I can't stress this enough, if we can roll out our booster program and lift that uptake of boosters, that will put so much downward pressure on transmission, because the booster will prevent people getting the infection, and it will also make them less infectious potentially when they've got even if they have any breakthrough. Now that is an important driver to drive down numbers in the community. So rather than talking about the case numbers, I think it's more useful to give the community what actions they can take, and that's the key action. And also be careful around people that are awaiting a booster. So if they're not within that 3 months, please be cautious, take those practical steps around people that have got underlying health conditions or very frail and elderly. Choose those outdoor environments, make sure you're not engaging with them or coming near them when you've got symptoms. You should be isolating at home. So those actions, individual actions, are really important.
How many deaths is New South Wales Health expecting to continue to record deaths with COVID over the coming months and over the coming years? Will it be a case of deaths with COVID will be equitable to a bad flu season, for example, and surely you have modelling on that, and would it be useful to prepare the community to see how many, just get it in their head how many people will be dying from this?
Well, I think that there are so many factors that go into those estimates, and so we can talk about future scenarios, and I think once we get through this wave, we can then talk about what are the projections for the future. But the future is actually a bright one. We are so fortunate to have vaccines that have held up and provided so much protection against severe hospitalisation and death. We need to use those tools maximally, and we'll also have antivirals. And then we also have an incredible community who adopt those protective behaviours, who are still coming out for testing, who are wearing masks, who are choosing to take their loved ones to COVID-safe environments, particularly if they've got underlying health conditions. So living with COVID will be very much about us using all the tools as we go through 2022. There will be peaks and troughs in numbers, and we and the health system, the whole of government and the community will work together to respond to those challenges. but we're in a much better place than we've ever been. We have antivirals coming, we have vaccines that work, new vaccines under development. This will be an ongoing journey, but we should be very pleased with the tools we have to tackle COVID.
From BA2 really fast. Is there any indication? Yes. Could I just have a really fast? On BA2, is there any indication? There appears to be some coming out of Norway, I believe, and Denmark, that it may be able to reinfect people who have already had Omicron. Is there any surety in that at the moment?
Look, I haven't seen those reports about the reinfection. Obviously, that's one of the things we look for. It has got differences from its parent Omicron, strain BA1, but those studies will be validated over coming days. It's amazing how the scientific community works together. I think if we can all recall that in that period when we had the BA1 Omicron, how quickly we learned about vaccine effectiveness, cross-protection, reinfection, and so I'm sure that over the coming weeks we'll have a lot more to say, but at the moment the comments would be that there's some thought that it might spread more easily because it's overtaking some of the BA1, but there's not a big clinical severity or a vaccine escape issue compared to Omicron, but obviously it's early days and we'll keep monitoring that very closely.
Are you frustrated that the Commonwealth hasn't done more to increase the booster shots in aged care?
Well, aged care is obviously a very challenging space, but we've always, from the state's perspective, said we're here to provide additional support to the Commonwealth if they need it. So if there's an additional support that we can provide, as I said, from our state hub's perspective, we've had significant capacity in that system, and if we can provide further support, we're happy to do so. Whether that's been in the distribution of rapid antigen tests and vaccine rollout, booster rollout, whatever we can do to support, we will. It's not about us first then, but obviously from what's coming through, what I'm concerned about is when you look at the numbers that Dr. Chant went through today, what we are seeing is a significant amount of deaths in aged care compared to the rest of the state, and obviously from a booster shot perspective, those numbers are not what we'd like to see them.
Premier, the Treasurer's had a pretty good shot at the federal government today. How helpful do you think the Prime Minister might see that as he goes into an election year?
Eddie, I was Treasurer for 2 years, and there are always robust discussions that occur, and from our perspective, for me as Premier, any financial support the federal government can provide, we would certainly welcome it.
They haven't provided any support. That's the whole point of what the Treasurer is saying today.
Yeah.
Should they do more?
Well, I'd like them to provide some financial support just as they have in the past. It's been a partnership over the last 2 years. When I was Treasurer, I also didn't see eye to eye at various points in time, and you have those constructive and robust discussions. Ultimately, our job in our state is to get every single one of our businesses through to the other side. That's what we've done in Alpha, that's what we've done in Delta, and that's what we'll continue to do as we move through Omicron. Our success in this state has been to have the backs of every business in New South Wales. That's, when I look at the numbers as we headed into Omicron, we had an unemployment rate in this state of 4%. I would never have thought we would have achieved such a great outcome. And the reason we achieved that was because we put people before the budget. That's our focus. That's always been our focus over the last 2 years. I certainly took that approach as Treasurer, and Matt's taking the same approach, and it's the right approach. It's the New South Wales way. And yes, we'll welcome support from the Commonwealth Government, but from my perspective, we will do, from a state government perspective, everything in our power to get businesses through this period of time, to get people to remain in work. Because ultimately, budgets aren't there. The state budget is not there as an end of itself. A budget is there to look after its people. And that's what we are going to continue to do. Our budget, our strong budget here in New South Wales, is here to help people, families, workers, businesses right across our state. That ultimately, that is why you're in government. You're in government to look after your people, and we'll continue that approach in New South Wales. over the course of this year, just as we have over the past 2 years, because the numbers speak for itself. And as the Treasurer has clearly pointed out, if you invest in your economy, if you invest in your people, the budget will take care of itself. We've seen that over the last 2 years. Having a strong economy ultimately results in a strong budget position once you're through. If you don't take this approach, I'll tell you what you'll have. You'll have a poor economy, you'll have people out of work, and you'll have a poor budget position at the end of it.
Okay. The federal government and some fiscal conservatives make the point that there aren't lockdown measures in place. Businesses aren't hurting because of actions of the state, their federal or social restrictions. People are just not going out, so they don't want to get sick. So will it be a case that the state government or the federal government will need to continue providing support as the pandemic continues to move alongside the virus? People are getting sick, they don't want to go out, they don't want to get sick. Will that continue?
Well, the first point I'll make is I pride myself on being a fiscal conservative. But what you do at various points in time is you tailor your approach to suit the circumstances of the time. In the good times, our strong financial management in this state, which had been criticised, set our state up in good stead to invest in difficult times. That's why New South Wales has been in a position compared to anywhere else in the country to invest more in its people than any other state. And why? Because we had strong fiscal management for 10 years. But when the times call for it and the need is there, you invest. What was the first part of the question? You said something.
Businesses aren't suffering because of actions.
No, hold on, let me deal with that. Yeah, let me deal with that. So, when you're in lockdown, when we've had 2 lockdowns, that was obviously a very challenging time because we had businesses close, we had unemployment. I think we lost 270,000 jobs during that period of time, which we recovered every single one. Now, whilst this has not been a lockdown, and learning to live alongside the virus means keeping society open. What we did see, particularly over summer though, as we worked through this, is that many businesses were forced to close for a number of days because of a lack of staff. So to sit there and say that you should not provide financial support in circumstances where there's no public health orders that have closed business, the premise in that is wrong, because there have been public health orders. The 7-day isolation requirements, which was moved down from 10 to 14 days to 7 days, the impact of that public health order had a substantial impact on a range of businesses. As the Treasurer has said, that's why this approach we're taking today is specifically targeted. Now, as we move through the course of the pandemic, James, I don't know what curveballs will come our way. But what I do know is this: if people get boosted, we will stay safe. As that program rolls out, there's no doubt that living alongside the virus will ensure that we're keeping the economy, society, and businesses open. That's been our focus. But our job in this state is, when it comes to success during this pandemic, and the country has been overall incredibly successful compared to anywhere else in the world when it comes to handling this pandemic. That's often lost. That's often lost in the fact that we have one of the lowest death rates in the world and we have one of the strongest economies in the world. But from New South Wales' perspective, our success is instilling capacity, continue to have that capacity in our health system, which we built up. You can't turn that tap on overnight. Over 10 years, we invested record amounts in our public health system. At the outset of the pandemic, we invested an additional $4 billion to increase capacity, and we are seeing the benefit of that today. In addition to that, success is keeping people in work and businesses open. And that financial support that we provided over the last 2 years has ensured that we've achieved that end. And that approach is not going to change. And that approach could only have occurred, and it can only occur in a state like New South Wales because of our financial management over the last 10 years. The foundations in this state heading into this pandemic were some of the strongest in the world, and that means we'll continue to invest just like we have today, because we want every single worker right across this state to get through it.
Premier, just a question
last one.
on schools. Schools were opening this week.
Yeah.
Will all schools have the air purifiers they need when students go back?
Yeah. Good question. So there was an audit last year in terms of those classrooms or areas that lack ventilation were given those purifiers. And I do know that as part of this rollout with the rapid antigen test, and I was out at Chullora at the warehouse out there, they were also sending additional ventilators out for shared common areas. So if there were common areas at various schools, that they would be provided if required. But I do know that audit occurred last year in any classroom that did not have the ventilation that was needed was provided those purifiers that were needed were provided with them. Thanks everyone.
Thank you.